Hey everybody, this is Rose from Sleepopolis, and today I'm here to talk about 11 types of insomnia. Insomnia is the world's most common sleep disorder, affecting 1 in 4 Americans every year, 10% of us chronically. Before we dive into the 11 types, let's talk about what insomnia is. The definition of insomnia is trouble falling asleep, staying asleep, falling back to sleep, or all three. Now there are 2 main types of insomnia: transient, acute, and chronic. Acute insomnia lasts less than 3 months and usually resolves on its own without treatment. Chronic insomnia is also called insomnia disorder, and it usually lasts at least 3 months and occurs 3 days or more each week. Now, chronic insomnia doesn't tend to go away on its own, but it does respond well to certain types of treatment, and it's almost always caused by negative psychological associations with the bed and the attempt to sleep. So what triggers insomnia? Beyond the 2 big umbrella terms of transient, acute, and chronic, what other types of insomnia should we be aware of? Let's dive in and find out. Number 1 is a type of insomnia that most of us have suffered from at one time or another: adjustment insomnia. Adjustment insomnia is difficulty sleeping associated with a major life change, like moving or starting a new job or getting married or divorced. The transition can be positive, like having a new baby, or negative, like the loss of a pet. Stress, anxiety, and lack of familiarity are underlying factors in adjustment insomnia, which typically resolves on its own once you've adapted to the change in your life. If you've ever tossed and turned after drinking a cup of coffee, then you've experienced this next type of insomnia firsthand. Drug-induced insomnia can be caused by certain medications, alcohol, nicotine, and cannabis. Insomnia symptoms are also common during withdrawal from alcohol and cannabis, and from many medications like antidepressants. Now let's talk about comorbid insomnia. This type of insomnia occurs along with another disorder like depression, cardiovascular disease, or asthma. It can also result from certain medical conditions that cause chronic pain, like cancer and arthritis. Sleep onset insomnia describes difficulty falling asleep at the beginning of the night, or what's called sleep onset. This type of insomnia is characterized by a delay in sleep of 30 minutes or more. I asked Dr. Shelby Harris, licensed clinical psychologist specializing in sleep, what the potential causes of sleep onset insomnia might be.
One of the biggest causes for sleep onset insomnia is just an active brain, I think. A lot of people will get in bed when they haven't allowed themselves time to fully wind down, and they think of sleep as an on-off switch. So they get in bed and they just think they can turn their brain off, and it doesn't work that way. So we really stress a wind down time, being mindful, quieting the brain, and really treating a half hour to ideally an hour of like a dimmer switch for your brain. And that can be really getting in bed when you're awake and you're still thinking and your brain is still very alert, really causes the body to think of the bed as a place of still thinking. And that can condition your body and your brain to really use the bed for awake instead of sleep. So that's, I think, in my opinion, one of the biggest reasons for onset insomnia.
Next on our list, middle insomnia. If you suffer from middle insomnia, you wake up during the night and can't get back to sleep. Middle insomnia is sometimes associated with alcohol use and chronic pain. Hot flashes and night sweats during menopause can disturb sleep too. Now, if you wake up around dawn, that's called late insomnia, when it feels too early to get up and too late to go back to sleep. This type of insomnia is often associated with emotional stress, circadian rhythm disorders, and low blood sugar. Next up, conditioned insomnia. This is when insomnia becomes a conditioned response to going to bed, and it's usually the mechanism behind chronic insomnia. I asked Dr. Harris, what are some of the triggers that can cause conditioned insomnia, and how does it start?
So conditioned insomnia in adults, the idea is kind of what I was just talking about, is you're getting in bed, and your bed is a place where you lay awake at night, and you're thinking, you're tossing and turning, and you've literally conditioned the bed as a place for being awake and thinking. And that's the whole reason behind using stimulus control. So that's get out of bed if you can't sleep. If you're not falling asleep and you're not even remotely sleepy, get up, go do something else in another room that's quiet, calm, and relaxing until you're sleepy again, and pair the bed only with sleep. And a lot of people who have this conditioned insomnia will notice that when they go away on a vacation or they sleep somewhere else, they actually sleep better in other locations because they haven't conditioned the bed with night after night of frustration and laying awake and tossing and turning.
Behavioral insomnia of childhood begins when a child under 5 is not given a strict bedtime. This can cause sleep difficulties like refusing to go to bed, wanting to sleep with a parent, or getting up repeatedly during the night. Untreated behavioral insomnia can cause issues beyond sleepiness, like poor performance at school and temper tantrums. Idiopathic insomnia describes insomnia with no apparent cause, but recent research has found that this type of insomnia probably does have a cause: hyperactivity of the central nervous system. This can be caused by an exaggerated response to stress by the body, which remains in a hypervigilant state, making sleep difficult. Next, we have paradoxical insomnia. Sufferers think they spend hours lying awake, but the amount of time they spend sleeping is within the normal range. Last on our list is sleep hygiene insomnia. This refers to poor habits like using electronics before bed, an inconsistent bedtime, or drinking alcohol and coffee in the evening. Nighttime exposure to bright light from lamps and electronics can cause insomnia, even if you otherwise practice good sleep hygiene. So there you go, the 11 types of insomnia. If you'd like to find out more, check out my article linked below. For more about insomnia symptoms, causes, and treatment, just Google Sleepopolis insomnia and my article will come right up. And finally, if you found this video helpful, be sure to like and subscribe to our channel and follow us on social media. Until next time, see you later, Sleepopolites.